People go for an exam, go for a checkup, right? There are people who do a checkup every year. Then you go there to do the checkup. Blood count, blood sugar, total cholesterol, a bunch of things that aren't very useful that will probably all come back normal. Then the person comes back all happy saying, oh, I'm great. That I'm great means I can eat whatever I want. I can drink whatever I want. This exercise thing hasn't had any impact on my life so far. And what have I noticed? When you look at these checkups, a lot of things are missing. I mean, insulin, for example, it's not included in any checkup, right? No.
Not a single one.
For one reason or another. Almost no one asks. They're very afraid. Cholesterol is extremely dangerous. Everyone is scared to death, but no one is worried about homocysteine. They're afraid, but not worried.
No one asks.
No one asks for their own insulin, but they do ask for glycated hemoglobin, right? They already asked for glycated hemoglobin. And besides that, you have results that are within the normal range we see today, which is not normal at all. Here are some classic examples. How can an insulin test, for example, vary within the normal range from 3 to 23? That's not really a normal range, right? How can someone with an insulin level of 3 and someone with an insulin level of 23, the guy who has an insulin level of 23, does he already have metabolic syndrome? Really?
He already has acanthosis nigricans, right? That dark patch.
Yes, the classic patch.
Many believe a neck patch is just dirt or poor hygiene, but it's actually a sign to check insulin levels.
That's a classic sign right there.
T-May had it, right?
Timai, the blacktail.
You could give it for free. T-May already had it.
Classic insulin.
I have a childhood friend from Calatinho. After years apart, we met again and he was doing great, really successful. We're close, and as men, we never let things slide. When he arrived, we joked around as usual. Then I told him, look, seriously, you have type 2 diabetes and restrictions.
I don't even need to see the test results, right? Just by looking at you.
Are you crazy? What do you mean? Why are you saying that? Is there a spot on your face? That's insulin resistance. Losing weight will make the spot disappear and lower your insulin.
No, then you do it, maybe 21. Then he'll say, see, I did it. It was 21 within range.
It's within range, so there's no problem. You just need to sit down.
Right? But look at my concern about this. Because you have a range that says it's normal, but we know it's not. And this applies to several tests. For example, insulin, we just gave that example here, right? An ideal insulin level, I don't know the standard you use there, but ideally, it's below 5.
A good insulin level is 3.5, ideally under 5.
Follow the standard. I did mine today and got a 6. I was worried. But since I just got back from vacation, I figured that was why. It's normal for vitamin D to be above 20 up to 23. It's okay, it's not, it's low. And the classic B12 at 300, my mom made a face and went to the doctor. I love and adore my doctor, so she went to see him. And my mom is having memory problems. Her thinking is slow and all. Sometimes she cries for no reason. She takes the test. My mom, let's see, B12 is 300. It's low. Then she said no, but my doctor said it's normal. It's within the range. I said that too. I don't know what protocol you use, but it's a good one. B12 should be above 900, preferably.
In my view, a B12 level of just over 300 is a critical B12, critical. In my view, it's critical. It's not even acceptable. Oh, that's a bit low, isn't it? I think it's serious. Your B12 is really bad. Just so you know, in Belo Horizonte, there's a lab with a B12 reference value of 111.
My God.
411, one of the most famous labs in the city.
But that's just the lab average, right? They don't just say change, Gauss.
That's it. It's the statistical curve. You just take people and make an average out of that. There are people who will be above 1,000.
Yes.
Some people will be at 100, but the average will be around 300.
But is the person who's going to take the test healthy? Statistics. Let's talk statistics. Of course, there are people who are going to take the test and are healthy.
But statistics have to consider prevention, right? In the past, no, only people who were sick would take the test.
Nowadays, maybe it's getting better. But the people who are taking the test have complaints, they have some kind of complaint, or are older, already have something. So this average can't be considered normal. Vitamin D is a good example. people who only get it today are the ones with vitamin D. This average just tends to drop, and that worries me a lot. First, the patient doesn't even take it to the doctor, right?
It's within the reference range?
Everything's normal here, right? I'll just go on and be patient, right? Everything's fine. I'll keep drinking, I'll keep eating whatever I want, not exercising, and so on. Even worse, if he tells the doctor it's fine. How can we get out of this? Why does this logic seem like a silly thing, João? But what happens, let's take the example of insulin again. I was talking to a doctor last week and I spoke with her. Look, I have a view that the worst thing that can happen to a pre-diabetic patient, I'll call them pre-diabetic. But that patient who is already having changes in their blood sugar, it's for them to go to the health clinic and receive a prescription for metformin and, I don't know, gliclazide. That's the worst thing that can happen in this guy's life. Because in his mind, those two medications are going to help his diabetes, or they're going to solve his diabetes problem. He'll maintain his lifestyle and won't change a thing.
He'll rely entirely on the medication.
In your medication, you know?
And that's just how it is.
And then, again, sometimes you don't even check your insulin, don't even look at your A1C, and you do that so-called treatment, right? Because metformin isn't going to help you, right? It improves insulin resistance. But there, the cell is already full of glucose. You're going to push even more inside, but it won't solve the glycation. And we haven't even talked about it yet, and this patient doesn't fit into what we started talking about at the beginning, which is the integrative approach. You say, my friend, let's do something. Not that I'm against medication, for God's sake. If you're taking metformin, keep taking it. That's not what I mean. Most importantly, stop overeating carbohydrates, as they're causing your diabetes and will also cure it.